Welcome back to the show. I'm your host, Ankur Patel. And today I have a very special guest on our show today, Mark Michalski, the CEO of Ascertain. Now, Mark has a really incredible background. Not only is he a technologist, but he's also a licensed board certified radiologist. So he has both sides of the equation for what it means to introduce new technology to a really, really important vertical out there, which is healthcare. Mark, welcome to the show.
Thanks very much for having me.
Yeah, absolutely. So to start off here with the episode, we'd love to learn a little bit more about the mission and vision of Ascertain.
Yeah, absolutely. Well, Ascertain is a joint venture between Northwell Health and Aegis Ventures, which is a venture studio in New York City. What we're focused on is really making healthcare systems work very efficiently, effectively using automation. I used to work at one of the big tech companies that can get you an air fryer within 2 days, right? And one of the things that makes Amazon very capable of doing those sorts of things is all the automation that it has in the back end. One of the frustrations for me is that healthcare is really in the dark ages when it comes to using that kind of technology. And it's healthcare is oftentimes one of the most important things in our lives, especially in like the worst days of our lives. It's an important consideration for everyone. So when I came to Ascertain, it was really with the mission of bringing that best in class automation technology to healthcare. And I think that's an important mission for all of us.
I think that's exactly right. And I think the challenges are pretty daunting outside looking in. So we'll kind of dig into that in a second. But obviously, you have an incredible journey to where you are today. So for our audience, it would be incredible if you kind of just walk us through very quickly how you ended up here at this point in time.
Yeah, of course. Well, I'm a radiologist by training, as you mentioned, but I spent the last maybe 15 years now in this world of either technology or startups. Spent some time in academics, but it really, for me, I've always wanted to be a physician. I think I started out my career, my life in that direction. But one of the frustrations that I've had over many years at this point is how hard it is to practice medicine well. Increasingly over the years, it's gotten more challenging. And so I've found myself more and more trying to figure out ways to make the practice easier. I sit on the alumni association board for my old medical school, and I'm starting to get statistics about how many doctors are starting to leave. And for me, that's a tragedy because no matter what kind of technology we have in the future, even if we have really sophisticated AGI, I'm pretty sure that at some point, at that worst moment when you have a terrible diagnosis, even though you're going to want physicians that are backed up by great technology, you're going to want to talk with someone who's smart, kind of empathetic, understands you, and we don't want those people headed for the hills. We want those people actually taking care of other people. And so, the arc of my professional career has been really about using advanced technology, basically to get us back to a place where we were a long time ago, which is a physician and a patient in a room talking about the problems that the patient is having and solving some of those together.
I think this makes a lot of sense. I think I saw a news clip of you actually saying that leave the paperwork to the bots, that the actual physicians can do true patient care, right? And I think that really resonates with me because if you look at the role, and this is true for other verticals as well, but I think it's particularly for healthcare, it's like you have these really skilled professionals that go through so much schooling to ultimately provide really incredible care, but then they have to do basically administrative work as a huge chunk of what they do day to day, and that is draining, right? And I think we have technology that is much better at taking this off their shoulders than ever before. So I'm curious at this juncture with Ascertain, what opportunities do you see? Because I imagine there's so many, right? When you look at the universe of opportunities, so where do you start a journey like this?
Well, the opportunity in using artificial intelligence throughout healthcare is pretty vast. You have to split it up somehow. And the way that we tend to think about it are what are the clinical opportunities, the ones that really are involved in the meat of healthcare, and then what are the parts that are the business of healthcare, the operational back end. And so at Ascertain, we look at both of these, but we're principally focused on the places where the healthcare enterprise is struggling the most. And if you can believe it, it's actually on that second part. A lot of the business of healthcare is the really challenging side. Healthcare providers operate on a margin of 1% typically. That's a kind of an amazing thing. And so if you are ineffective at getting paid, we call it revenue cycle management in healthcare because it's so complex, it's not just billing. But all of that is so complex. Just having that not work well means that you've got cash crunches at some of the largest healthcare enterprises in the world. As a matter of fact, there's recently a central vendor for a central clearinghouse for the way that providers get paid by insurance companies recently stopped working very effectively. And this became a big issue for healthcare providers, still is. It just shows you how important that component of healthcare is. And so that's where we're focused on. But, my mother asked me this, are you still a physician? Because you're talking a lot about like this, like supply chain and call centers and like, all this revenue cycle management. I said, I'll have to do this until we figure out a way to like, solve these problems, and I can get back to, the reason why we went to medical school or nursing school or PA school in the first place. That's really important.
I think that makes a lot of sense, and I think we'll kind of get into sort of the different applications that you're taking on going forward with Ascertain. But throughout your career, what has been the most exciting or transformative application of AI in healthcare that you've witnessed or been a part of?
Well, it's interesting. Part of the reason I'm in AI to begin with is because I was a radiologist, and for those who have been really into artificial intelligence, probably know that the modern AI revolution might have started in 2012 or so with the ImageNet competition. First applications of deep learning, and those first applications were really in the imaging world, application of CovNets to image classification, segmentation, these sorts of things. And so that had big implications for manufacturing, quality assurance, self-driving cars, and in healthcare, it was radiology. It was places where you dealt with imaging. And so this is actually not the first time we've seen AI start to make its way into healthcare. And in lots of ways, the imaging communities in healthcare, whether they're radiology or cardiology or the other specialties that deal with images like pathology, this is really the next step. It's another way that I typically describe this is what's happening over the last 10, 12 years is we're getting kind of an artificial brain, but we're not getting all the brain all at once. We kind of got the occipital cortex that deals with images first. And now we're starting to get parts of the brain that have to deal with natural language. And we had kind of frontal lobes start to emerge, and like with games and things like that. And so we're starting to materialize an entire brain, but we started with the occipital cortex and now have like all these other components. So getting back to the question, what are the sort of the exciting, most interesting opportunities in healthcare? I think we started with, those things that dealt with images and those helped with diagnosis. And now we've got so much broader an opportunity, that can impact things like ambient voice. That's a big one in healthcare now. How many times have you gone to the doctor and she didn't even look at you, or he didn't even look at you because they're looking at the EHR, the computer screen the entire time? The hope is now we can start to move those things closer to, you actually start to get the your doctors start actually looking at you because you have ambient voice working as a scribe. And I think that's probably one of the more exciting things in healthcare right now.
I think that's right. It leads to a more empathetic outcome for the patient, right? Where you do get that eye contact, you get that physical presence, which is so essential. You can have an incredible doctor, but if they're not totally dialed in to you at that moment in time when you're relaying, and in some ways, your most intimate vulnerabilities, like what's wrong with
Mhm.
you and how you're feeling, you just don't feel that level of empathetic connection that you need. And that's also really important to having a really beautiful experience when it comes to working with healthcare. And unfortunately, because you have all these systems where you have to jot down notes, which again is very important because it allows you to go and capture data that is going to help inform kind of the overall picture for what you're experiencing. It's just that it is a blocker for empathy, right? And I think having the automated transcription of that audio into the patient notes that needs to be there, I think enables better experiences. I think that's a great one. And I think I think exactly what you called out. And I think the other thing that you mentioned is that radiology has seen a whole lot of advancement from the imaging capabilities over the last 10 years. And I think we're moving on to more, what I would say is like language oriented capabilities within healthcare.
Yeah.
Is that right, Mark?
I think that's right. And, I also think about sort of the technology having evolved sort of as bookends. In healthcare, we got really, I think this is probably true in not every industry, but I can just speak from the healthcare and life sciences perspective. We, in the aughts, in the early teens, we got really good at generating data. That is to say, we brought in high throughput sequencing for genomics, and we put in EHRs in your medical records that start capture all this data about you, and so you can see in many different ways we've gotten better and better at capturing data, but that's like one end of the bookend. The other side meant that because we had all this data, we didn't know how to parse it in a meaningful way. We didn't know how to derive meaning from it. We didn't really know how to action it effectively. And so we're kind of left with this terrible situation where as a physician, you're given all this data to deal with, but no real technology to allow you to manage all of this like, tidal wave. And
Yeah.
again, we saw the same thing in life sciences and all sorts of omics, right? Of what opened up this aperture of the data related to what it is to in life sciences. But it's not until recently that we've gotten technologies that's allowed us to parse all that data and bring it back down to a meaningful conclusion. So that, I think, that really is the promise of what we're looking at now with Gen AI. And that's the hope, is that finally we'll take all this the tidal wave of data that's come into healthcare and life sciences and start to make it actionable, meaningful, parsable. So
Yeah.
finally we'll get
I think I think that I think to me that's clear. There's been a tidal wave of data explosion, and you see that across verticals, right? In healthcare, of
Mhm.
course, you see that with all the data capture, all the great data capture that's happening. It could even be drilled down to things like IoT devices that people are carrying, right? It could lead to
Yeah.
better health outcomes, but part of the challenge is how do you get that data out of those devices into the healthcare system, and then basically have technology go and interpret that data alongside all of the other patient record data
Right.
that exists to ultimately lead to better care. Because otherwise, in isolation, is just more data, and more data actually is sometimes noisy and confusing and overwhelming. So actually, may lead to actually worse outcomes unless there's a means to go and deal with that extra intel that's there amongst all that noise.
Yeah, I mean, you said it exactly, and it's a great example. When wearables started emerging, I know colleagues of mine in the primary care domain would say, my patients are starting to bring in their wearable data. I don't know what the heck to do with it and stuff. Like, look at like a CSV file full of heart rate and heart rate variability data and all this. I mean, what do you do with it? And I
Yeah.
think that leads to frustration on both sides. And the truth is that could be very valuable data. You need to find a way to ingest it,
Mhm.
parse it, make meaning out of it, and sort of contextualize it within the broader clinical picture. Yeah, that's something that I think AI is, the current uh, the current wave of artificial intelligence. We're all hoping will help us get to that place.
Yeah. I think that's said beautifully, which is that you need the right context from all that data in order to then go and make a decision. And that's what large language models and other like newer AI capabilities are doing. Is like trying to get the right context, grabbing onto that, using that then to go and make some decision or generate some output that's meaningful. So obviously we've identified many different areas where AI could be helpful, right? It's almost like the number of areas where AI could potentially be helpful is massive. So, in your opinion, what are the biggest barriers holding back the widespread adoption of AI in healthcare? And how can industry leaders and policymakers work together to overcome these obstacles?
Yeah. Well, in healthcare, unfortunately, technology doesn't necessarily have the best reputation. There's been many times in the history of the collision between of technology and healthcare hasn't always, worked out super well.
Mm-hmm.
The move fast, break things mentality is really different than, say, a surgeon, right, who's done the same
Yeah,
thing every day, every single day the same way, and you want them to, right? You don't want them to move fast and break things when it's
sure.
your surgeon. So there's a lot of caution, I think, in the healthcare community in bringing in new technologies and things like artificial intelligence. And because artificial intelligence, this is maybe the next wave, but we've had kinds of artificial intelligence like the kinds that impact diagnostics. We also know some of the natural limitations of the tech. For
Mm-hmm.
example, uh, there's now good evidence which shows not only that technologies that are very very good at helping physicians or radiologists diagnose on CT and MRI. We've also found that the biases that are encoded in the data that are sort of systematic structural biases are also encoded in those diagnostic systems, and so that's one of those big considerations. Another one is that the existing disparity in the way that the healthcare our existing healthcare industry deploys its resources against different kinds and parts of our communities. That it's really it looks like if we're not careful, this technology is going to exacerbate those disparities, not improve them. So I think for healthcare, that's one of those things where we think a lot about. We're naturally cautious, and that is a place where there's a natural barrier to its adoption. We also have regulation, we have reimbursement, and
Mm-hmm.
as I said earlier, that healthcare providers in this country oftentimes work on relatively narrow margins, and so
Sure.
helping them understand the business sense is also oftentimes a big barrier. All that being said, I think there's also a natural sense that healthcare cannot continue operating the way that it has in the last, over the last couple of decades. There does feel like
Yeah.
there's something coming that feels maybe not quite like a breaking point, but a moment where healthcare needs to incorporate some of this technology for it to
Mm-hmm.
continue to serve the population that was built to serve. So that's the counterpoint. And I think
Yeah.
it's up to clinicians, to patients, to industry, to regulators to navigate how to make sure that this technology does make its way into the healthcare community while doing it in a safe way.
Yeah, I think it's very clear to me, looking at the space, that there needs to be better outcomes. Because if you look at healthcare, I mean, this is a well-known fact, right? That healthcare costs in the U.S. are the highest in the world, but the outcomes are just not commensurate with the amount that we actually pay into healthcare. And some of that is directly attributed to just the complexity, the monstrosity of the machinery that goes into healthcare, right? The billing and the way the insurance is handled, and when all those little things add up, it adds up to material, or I'd say administrative burden on the system.
Mm-hmm.
And that's, I think, where technology can help reduce some of the kind of the added administrative cost, so that you could deliver the same level of care but do it more cost effectively, right? It's just more efficient. We see these in adjacent industries. So I'll give you just examples here: mortgage underwriting or insurance underwriting, where if you could go and streamline the process that's involved in the actual underwriting, that cost doesn't get embedded into the mortgage rate that you pay or the insurance premium that you pay, right? Because ultimately someone's going to pay for that, and it's the person, the policyholder, that pays for it indirectly
Mhm.
through the embedded interest rate or the insurance premium. So I think healthcare is a similar thing where things get baked into the price. And by thing I mean the administrative work that's involved gets baked into that price, and I think that's where the big unlock can be with technology. Obviously, there are many roles in healthcare that require patient care, that require empathy, what I would call like high EQ, and they're very unlikely to get displaced at all by AI. But I think there is the potential for AI to revolutionize healthcare, and it raises concerns about job displacement and widening skill gaps. Um, how can the healthcare industry ensure that the benefits of AI are distributed equitably and that workers are prepared for the jobs of the future?
Yeah. Wow. Well, that's probably the question, I think, and maybe not just for healthcare, but for all of us, right? I think if if we are successful in bringing artificial intelligence in a meaningful way to the industries that we serve, then it will necessarily mean that the way that our lives work, our work lives, our personal lives, will be different. And I personally feel that that's a great thing. I think that there's just tremendous opportunities for what this means for the way that patients will receive care, and it will mean that, at least from my perspective, I have a perspective that it will mean that physicians will do more of what they went to medical school to do, that nurses will do more of what they went to nursing school to do. I'm very optimistic about it, but I also feel that it will necessarily mean the way that we train, the way that we learn how to do this kind of work will be so different. You know, I can't tell you how many exams I've done in over the course of my schooling, professional life. I literally can't. And most of that was about sort of understanding some fundamental aspect of biology or pharmacology or anatomy or whatever, that now is probably better left to a query to
Yeah,
an LLM. And what I think, but the things that stay are the some thousands of patients that I've seen over the course of my life, and understanding how to communicate bad news, how to communicate good news, how to present options. And that, like you said, I think that is the core of what it means to be you know a practitioner of healthcare, of medicine.
sure.
And it's not the Krebs cycle. it's
Yeah.
it's basically that, and being a trusted ally in the worst time of your life. So, getting back to that is something that I'm really enthusiastic and excited about.
Yeah, yeah. I mean, it's hard because if you've been in the profession for a long time, new technology, you kind of look at it a little bit cautiously, right? You're a little bit wary of it. It's easy to say like,
Mhm.
if you're a technologist or you've spent some time in technology, like at a startup or a big technology company, you've seen it firsthand, and you maybe embrace it a bit more. So technology is more in your DNA. But if you're old school healthcare, you've been doing it for a long time. You've been used to the way that you've been kind of working with patients, and you have a particular set of processes and protocols that have been built in with purpose. You don't necessarily want that to change overnight, right? So I think there is a little bit of caution around the introduction of a new technology like AI. I think there might also be a fear that it's hyped or overhyped to some extent. And I think you've done a great job mentioning the importance of embracing AI technology rather than fearing it. But I'm wondering if you could share a message of inspiration for other healthcare professionals who may be a little bit apprehensive about the impact of AI on their careers or the
Mm.
industry as a whole.
Well, I will say one way you can parse this, or one way that you can react to it rather, is back in 2016, somewhat famously, Jeff Hinton said, I think he might have even said it at a hospital. He said something like this at a conference, where it was completely clear to him that radiologists that we should stop training them. That there would be no need for additional radiologists in 5 years. So that was
Mhm.
2016. And I'll tell you, yeah, I'm not, you know, I was very enthusiastic about the technology at the time. I still am. I will also tell you there's never been a better market to be a radiologist. And the reason for that is because the technology, the automation, the capabilities of automating what we do as clinicians or radiologists was overwhelmed by demographic changes and
Mm.
trends towards using more and more imaging. So actually now we've got a shortage. Now, for me, that's actually kind of it's a mixed story for me
Yeah.
because I would have loved to have seen a world where this technology automates a lot of what radiologists do, so that we could focus on the next thing and the next thing and the next thing. And um, I think that day is coming. And I believe that, you know, we as practitioners of medicine, just like anyone else in any other industry, cannot ignore the fact that this technology is going to change the way that we do our work one day, or like sooner or later. And don't you want to be the one that's helping usher that in? I want to be part of a future where, you know, my niece goes and gets an MRI that is highly influenced by an artificial intelligence read, and ultimately that read goes to into the hands of a physician, a person, which communicates those findings to, you know, to my niece in a nice way, you know, like in a way that is a human way. And I think, you know, that's the future that I want to see. And I think if,
Sure. Yeah.
you know, as patients and as physicians, you know, we all kind of want to see that. It's just how do we get there safely?
Yeah. Yeah, I think that's right. It's like the intent is very clear, which is deliver better outcomes. Is the means to do it is sometimes, um, even if it's the right means to the right ends for the industry as a whole. So introducing technology or AI is really really beneficial in terms of delivering better outcomes, um, which is not always a given. Of course, like things can be a little overhyped on occasion, but even if that's the clear um, uh, kind of intent and people are sure that that's the case, it still may mean a slightly detrimental or scary outcome for the individual, right? That's where you
Mhm.
see a little bit of like inconsistency in terms of like individually you might be a little apprehensive about it even if you feel great about the outcome as a
Yeah.
whole. But I'm curious about the radiology example because it's been around for a long time now, right? And I think I'm not I think that there probably is a great degree of radiology that is being automated by AI. Obviously demographic shifts make sense that because of that there is still a huge need, but how much of radiology today is AI driven versus human centric that requires actual radiologists to go through? Because the other trend that I think has helped radiology is doing more radiology remotely, right? And
Mhm.
processing it basically with radiologists around the world, which has also reduced the cost and the time that it requires to get analysis done of the different imaging that's present there.
Yeah, I think that's right. You know, radiology is one of the more tech oriented, you know, specialties, and it has a lot to do with history. You know, back around the turn of the millennia, we started digitizing at a time when, you know, very little else in healthcare was digitized, and it was out of necessity. It was essentially you know, CT scan, MRI, ultrasound, whatever it was. You wanted to store that in perpetuity, and ultimately, once you've digitized it, then it made it possible to view it, interpret it in many different
Mm-hmm.
places. So we were kind of fortunate in the healthcare community to have that early on, and that also put us in a, you know, great position to participate in what was happening in artificial intelligence when it started to hit in, you know, 2012 and beyond with cognets and deep learning. But I would say that you, one of the expectations was that, you know, cognets and deep learning would ultimately make feature recognition within those CT scans and MRIs and whatever else essentially automated. And it turns out that one of the big things that humans are pretty good at, that at least the cognets alone were not good at, is contextual awareness. That is to say, there's a lot of context which goes into understanding what that, you know, that what that lesion in in your right lower lobe or your liver or something is. It's not that kind of thing is um, needs some broader contextual awareness. And
Hmm.
it also turns out that the way you acquire images, all these other things, are really important features of the practice. So uh, I think a lesson coming out of that is that, for whatever industry, whatever product you're building that's AI enabled, if it only automates 90% of the task and leaves 10% left, that
Yeah.
still means that you have to have a person in place
Hmm.
to do that 10%. And then if you're paying for that person anyway, then now you're paying for the automation solution and the person,
Sure.
and that
Yeah.
ultimately ends up being the failure mode for the product.
Yeah.
So that can't just be radiology, right? We saw that. So that ended up being a blockade for adoption because if you don't have something that can automate the entire task, or you haven't found a part of the workflow that you could automate independently, then you got a product failure.
Yeah.
So
Sure.
that was a lesson early on, which has led to less adoption than you might expect.
Yeah, and I think that's a really great example because that is something that happens in all verticals, right? All AI that's introduced is that there's a need for a human in the loop to address the situations where the AI can't completely get there or the AI is not confident. And so, in order to go and close the loop, or at least address the shortcomings of the model, you need a person to go and review the output. And of course, it would be a beautiful outcome if like 80% of the time the model was 100% confident, and then you
Mm-hmm.
only needed the human to review the remaining 20%. So the human in the loop aspect might be reduced to just 20% of the volume, but the 80% was fully automated away. That would deliver ROI. But too often, what you see is that basically you get some partial level of automation, and then you still need the people basically kind of doing the review. And so you're going to
Mm-hmm.
pay for the people and the technology. But kind of the rebuttal to that is the people that are in those roles can do 5x the amount of work, right? The same number of
Mm-hmm.
people because they're not doing quite as much of that entire end-to-end pipeline. So doesn't that lead to greater adoption, or is that not how it actually ends up working in practice?
No, I think that it does, and I think um, probably that description is more relevant for what's happening with Gen AI and LLMs than it was maybe for CovNets, and in the particular instance that I gave you, which is, we're imaging someone, we're trying to come to a conclusion or a diagnosis. That's pretty high stakes. You're gonna
Sure. Yeah.
Oftentimes
Yeah.
it's high stakes, right? And
Yeah.
so you want a person involved and you want automation involved, and that ultimately just means higher costs if both of those things are in place. What ended up working though was using this technology to triage. So make sure that the CT scan of the head that's most likely, if I'm an emergency radiologist in the middle of the night, I've got, a busy ED, and I'm reading through, I've got like 10 or 20 CT heads in the queue. Having an AI that can say, hey, you might want to look at this one, that actually ended up being a good solution and ends up
Hmm.
being part of our workflow. So ultimately, AI products are still just products. And with that, the implication that, you have to understand the workflows that you're, influencing, enabling, changing. Same as with any product,
Sure.
that still is the case. So AI tech in radiology and healthcare broadly that worked was, products that really had a lot of customer empathy and understood the workflows pretty deeply.
Yep. Yep. I think that's right. Well, what I really love about Ascertain is the fact that you have technologists and you have the domain experts, right? It's a rare thing because with the partnership with Northwell, so you get to marry the two. But I think in general, what you typically see is you see healthcare professionals on one side, maybe they're the buyer, and then the technologists that are they're almost coming from the outside and they're trying to introduce something into the space. That's not always the case, but I don't really think there's a tight level of collaboration. So I'm curious from your perspective, as AI becomes more sophisticated, there needs to be a tighter coordination between industry and technologists. Um, Now, how can we foster a culture of interdisciplinary collaboration to ensure that the AI solutions are designed with the needs of patients and healthcare providers in mind?
What a great question. And I think that is probably the question in a lot of ways, how to bring all these different constituents together to solve the problem. I think that there is no one answer to that, but I would say that increasingly it's finding ways to partner across different constituents throughout the marketplace, including the patient's voice, the physician's voice, the innovator and the technologist's voice. We haven't always been super good at that. And there's now, I think, recognition broadly on both sides that we in healthcare can't build it ourselves, and those in the technology world can't really understand what we can't. That healthcare is not really, at least up until now, has not really been disruptible in the way that they felt maybe that it could have been. And I don't know that it will be. So I think that's the thing is, with a increasing, we kind of start to learn more and more about ourselves, in the healthcare world and technology world. And I think with humility coming together, understanding that we both need to be at the table to solve these problems, or we all have to be at the table to solve these problems. I think I'm hopeful that we're closer to that than we've ever been before.
Yeah.
So that's the best answer I have. I don't know if it's the most satisfying one, but that's I am hopeful because I see more and more of that.
Sure. Yeah. I think that also makes sense. It's just I think it's going to be a hard thing to replicate, which is like, can you pair technologists and professionals together? But let's drill a little bit more into the journey and the work that Ascertain is doing, because obviously you're focused on automating back-end processes in healthcare. It's only been about a year or two in, I believe, but at this point, can you share some of the early success stories of how AI has streamlined some of the administrative tasks that you've identified, and the impact that it's had on healthcare providers and patients?
Yeah, absolutely. Well, one of the very first places we decided to look is at the pathway for patients to get out of the hospital. So no one actually wants to be in the hospital. Pretty sure that's the case. But if you're in the hospital, the sooner you get out, the better, and the sooner the hospitals can get that bed to the next patient, the better it is for them, because there's just so many people to take care of. So that's where we focused, is how do you get patients that no longer need to be in the hospital, out of the hospital, back home or at a subacute care facility, essentially getting them to the place where they're going to get the best care. And so that is a complex task. You need to get the insurance companies to get the prior authorization approved for, if you're going to a skilled nursing facility, you have to arrange things like transport. You have to understand where beds are available. This is a multifaceted process that it takes a lot of energy, not just from the social workers and the case managers that take care of these patients, but it's also, it's the physicians doing this and the patients sitting there for hours on end, not knowing what's going on. And it's just a terrible experience for a lot of folks who want to get out and get on with their lives. So that's where we focused, and we've done that within Northwell, which is one of the largest healthcare providers in the country. It's actually the largest healthcare provider in New York State, and they have many groups that have to do this, but they have a central administrative team that's charged with attacking this problem. And so where we focused is enabling that team to be supercharged with AI agents that allow them to hit each of those core tasks to get patients out of the hospitals. So while it's a big task and we're still learning how to do it effectively, it's looking pretty good so far. I think it's pretty promising from our lens that we'll be able to meaningfully impact an important metric for healthcare, which is how long patients are in the hospital, length of stay.
Yep.
And we'll start with Northwell, but I think it's going to be something that's going to be useful for a lot of healthcare systems.
Yeah. I think I love how you're so intent on a particular business outcome and trying to focus on how to improve it. Because then it's not technology for technology's sake. You're not just trying to introduce some new feature or new capability. You have a really clear business intent in mind, and you're able to measure that.
Mhm.
In terms of actually getting the technology to deliver on that business outcome, what does this look like? Is it, is it a completely rebuilt web app with AI agents built in as part of it? Do you do this through APIs that are integrated on the back end with their pre-existing stack or systems? I'm just curious, like, for the viewers of this
Yeah.
podcast, what can they learn about how to go and implement really complex software like this into a very large, complex pre-existing stack that a Northwell and others have?
What a great question. It's a challenge. I would say that, yeah, healthcare, like a lot of industries, is an amalgam of existing legacy systems, applications that are built on .NET, and like may not have modern APIs to ping. So you are forced in those instances to do all sorts of things to try to query backend databases or work with the user interfaces directly. Sometimes it's possible, sometimes it's not. But from our vantage point, I think it's most important to start with the presumption that you're going to maintain the existing workflow that an end user is currently in. And so we don't, one of our products, one of our product virtues or product values is to not extract an end user out of their existing workflow unless it becomes absolutely necessary for them. So we try to keep them in their existing systems. We try to support the existing IT investments within the healthcare enterprise, but automate a lot of the back end systems using, pretty robust agent framework that we're, been working on for a while. And, embedding a lot of the specific healthcare knowledge that we've acquired over, however many years we've been doing this,
Yeah.
including some of the stuff that Northwell's brought to the table, which is just a tremendous amount of detailed knowledge about how to do discharges effectively. Start doing embed that within the agents themselves. So I hope that answers the question, but it's a short form. It's not easy.
Yeah, I think our philosophy around workflow automation is similar, which is in these regular industries like healthcare, you're very unlikely to change the present workflow in a material way, nor should you. I mean, because you have so many people that are trained on that workflow, on that stack, doing the motions they need to do. So assume that that is the present reality that you're unlikely to go and change materially. It's given that present reality, given their stack, what can you automate on the back end that is going to materially move the needle? Knowing that AI is not going to be 100%. So it's like you can't skip entire steps from day one. So part of this is going to help assist humans in the work that they're doing. So it's
Yeah.
going to go and move the needle materially, maybe help skip partial portions of it. Eventually, you could start maybe skipping more significant aspects of the workflow. But you have to work with the stack and with the individuals who are trained on that stack, rather than trying to go and have this like aspirational dream of gutting and replacing everything. Right.
Yeah.
First, it's not going to work, and you also won't fight that fight. Like you just won't get in the door that way and get the organization to shift. It's just too jarring of a shift, right? It's too risky, and it's likely to fail for 1,000 reasons, right? So, and I think that's right. I think you have to be very, very pragmatic, and I think sometimes technologists get lost in that. So I really appreciate that ethos that you have around how you get that product in the door. But I am curious. A lot of this is very complex to do. Um,
Mhm.
I think a lot of people that go into technology think that they're going to build one product and they're going to get that same product in the door across the board, Northwell and many other hospital systems. So, how do you think about the services layer that's necessary, seemingly necessary here, I imagine, in order to go get that product up into the door and into the work that a lot of these institutions are doing?
Yeah, I think that the services component of any organization that does this kind of work starts bigger than they may initially anticipate. And then everyone hopes that ultimately it starts to be attenuated over time. That is to say, you're doing less new discovery and change management and all the fun stuff that goes into actually bringing some of this technology into the enterprise. And I think that the reality is, if you look at approximations of our industry, maybe a good one is the cloud services business. It titrates towards this world where you always have to have empathy for the customer. You always have to have empathy of, for the product layer, the app layer, and you almost always have to bridge it to, if you're a platform and service, you almost always have to bridge it with some services component as well. So that's the way that I think about it. I just try not to delude myself too much about
Yeah.
how much of that work we're going to have to do. But I think that on the flip side, it's part of what for Ascertain, that's part of what makes us, I believe, special. We understand our customers. We understand the problem. We work back from our customers, and we build a lot of empathy before we put in our first line of code. And sometimes it has nothing to do with AI. Sometimes the discussion takes us in a direction where we're not the right folks to solve the problem. But I will tell you, increasingly there's an understanding about what this technology can do, because the proof points are starting to emerge in our industry.
Yep.
And you can point to them, and then people start to grok what it is that you're actually up to and what you're actually trying to do. That makes the services component a little bit easier to navigate, because then you have lots of use cases and proof points that you can point to.
Yeah.
It is early days, though. I won't give the wrong impression. Got a lot left to do, but
Sure.
at least that's my perspective.
Yeah. Well, to close this out, for healthcare CEOs and hospital group leaders listening to this podcast, what are some of the key considerations they should keep in mind when implementing AI solutions within their orgs? Or maybe they're even earlier on, they're not talking about implementation, right? They're just thinking about what initial strategies should they devise and what POCs and pilots should do. What's your advice for them?
Yeah, no, it's a great question. I think that if I'm a healthcare CIO or CMIO, I know a couple things. I know that artificial intelligence is hot right now. I know that my board is probably asking me to implement an AI solution or a strategy, and I don't necessarily know what that means. I may be trying to figure that out. I know that there's tens or even hundreds of vendors that are coming to the table that are promoting their services. And so one reaction to all of this is to simply hit the brakes, slow down, try to learn as much as you can, get a bunch of vendors in, learn more, talk to my colleagues, and all of this stuff, all that's important. But I would also say that we've seen a lot of technology waves happen before in healthcare. This is a big one. It's not one that you can avoid and sort of pass up. It's going to be a big deal, and those leaders that embrace this as not just another technology hype cycle, but one that can be transformative for their enterprise. I think there's going to be, I'm seeing a couple of them. They're the ones that are going to emerge as the folks that define the industry in the next
Yep.
5 to 10 years. So I would say it is worth the investment to not just talk with those vendors, not just think about the strategy, but really dive in and try to learn as much as you can. This is a wave that you want to ride, and your enterprises will be much stronger for having done it. It's not just another hype cycle. I really, if we're close enough to it that we know that it actually works, and it really works in a really powerful way. So that would be what I'd say.
Yeah, and it's a really powerful message, given all your experience to date, given that you're doing this today and you're seeing the outcomes, right? I think a lot of people are stuck in this, like, they're thinking about, or they're in POC land, and they're like, is this really worth it? Because it's just an added cost, it's time, effort that they sink in. But I think what you're saying, and this is also what I see firsthand as well, is that if you make it to the promised land, the outcomes are so incredible that it's worth it, right? It's going to be hard to get those outcomes, but if you do, it's such a big payout. And we're seeing this, like, you look in the public markets, the ones that talk about it in their quarterly calls and such. massive, massive outcomes. So Mark, thanks for being on the show. These are amazing insights. Really happy to have you, really curious and excited to follow your journey, and hope to have you on the podcast in a year or two from now. And we could talk a little bit more about sort of where the state of AI is in healthcare.
Absolutely. Would love that. And thank you so much for having me on the podcast.